Hi, my name is Shivam Patel. I'm a rising senior at Duke University. Um, my major is public policy, and I'm minoring in chemistry. I decided to join the Margolis research internship because my professor for a class I was taking at the time, Dr. Megan Galanka, was a project manager for the project Intimate Partner Violence and conducting screenings in clinical settings. The class I was taking with her at the time was child and family policy research. And I was really passionate about learning about the challenges that families and children are facing. And this project was a really good intersection of sort of adding that element with my passion for medicine. My future career goal is to become a physician, and so I thought joining this project would really sort of give me a good opportunity to learn about the intersection of taking care of families and children and working in a clinical setting. And so one of the most impactful things about this project was it really taught me about the difference between just treating someone and sort of or treating a disease versus treating the root of a disease. So when I initially went to this project, my conception of healthcare and my conception of medicine really was sort of people come in with ailments, people come in with sickness, and healthcare settings take care of those things. They give them, some sort of drug. They give them some sort of vaccine. They give them some sort of treatment that will help cure their problem. However, when I learned about intimate partner violence, was that it was one of those things that was in the environment, and it was something that families were struggling with because it was something like physical abuse, mental abuse, things along those lines that were happening in people's lives, and there was no simple drug that you can give to fix those issues. And so, working this project, it really expanded my boundaries and my scope of what I thought, medicine could really be, and what it means to, help people, and what it means to, heal people. And so, working on this project, it really taught me, to think bigger about medicine, and not to just have a narrow focus of what it means for healthcare to treat people. Um, One of the great things about this project and this internship in general, was being able to work on teams and being able to communicate with others. It really helped me sort of learn how to, communicate my project, my opinions in a more professional setting. And it's not the biggest thing ever, but however, I think, being able to practice that and, do that, on a regular basis was really good. And I think it'll prepare me really well for the future when I'm in team settings again, and when I have to communicate my ideas. It gave me really good practice on how to do those things. Working on specifically on my research project as a team, it was really great being able to communicate with different project leaders, and working with other undergraduate researchers. I think it was really important for me to learn how to sort of practice in a field where I'm working with people from a diverse background, but also from a different level of education. We had residents who were working in our project, and we had professors, like professional researchers as well. And so having that mixture of experiences and backgrounds really helped to create a team with a diverse set of views, and it helped to help me get more out of this project that way. Just in general, with the Margolis internship, one of the greatest things, and I think the most rewarding things I got out of this, was the the knowledge and the idea that health equity is one of the most important things that we need to think about, and that health equity is one of those things that needs to be in the forefront of all the research that we should do, and it should be the forefront of research and policy. Just in general, with the internship, every week we had discussions about health equity in different fields. And so learning about health equity, it taught me that we have to be deliberate as researchers, when we think about implementing new policy, when we think about or doing research. Health equity should be at the forefront of everything that we do. And so doing this project, and working this internship, really just sort of expanded what I of how I do research. And the Margolis internship really sort of supported my work, in my specific research, because it made me constantly put health equity and use that, put it at the forefront, and help me use that as a lens in which I do my research for my specific project. And so it was really great learning about that and working on that. As I go forward, I think it's something that I will always implement into all the research that I do in the future as well. One of the more challenging aspects of this project was, I think, just like reading about all this literature and learning about all the challenges that, or not a challenge, but I guess learning about all the health inequities that are in our system. And it was, I want to say it was demoralizing, but it was definitely frustrating to hear about these things, because, I think people deserve excellent healthcare. People deserve the right, to have a good life. And, learning about all these things in our environment, in our social sphere, in our political sphere, that is negatively impacting the health of people, it was really frustrating. However, what was sort of, inspiring is to see all the different projects that people were working on, and all the different projects that people were focusing on and implementing health equity into those projects. And so it was great learning about all these different projects with the different interns in the program, because it sort of gave me hope that, as we go towards the future, we're in good hands with all these other interns and all these people, because what I learned about this community of interns was that we were all passionate about healthcare, and we were all passionate about making a difference in people's lives. And I think it was a really surprising sort of aspect of this internship, because everyone was really passionate about something, and and everyone was very motivated. And so having these conversations with people and being able to talk to the different interns, it was really cool learning about the different projects and everyone's different passions. And it gives me confidence that we in the future will make a good impact on healthcare. And before I finish, I just want to say thank you to all our project coordinators, and thank you to the Margolis Center for helping me get this experience. And thank you.